First up, we meet the team at the multi-disciplinary diabetic foot clinic at Dunedin Hospital and see the great work they're doing to reduce amputation rates.
This weekly clinic combines expertise from a wound care specialist, coordinating nurse, podiatrist, orthotics, diabetic nurse educator, endocrinologist, microbiologist, orthopedic and vascular surgeons. And this allows overall assessment of the patient as well as individualized treatment plan.
My role here is as the registered nurse, and I help to coordinate the patients through the whole clinic. I bring them in, I take photos of their wounds, I ask them basic history and find out who they need to see, and then manage that through the whole visit. So if they are a new patient to the clinic, then they'll need to be seeing everybody, and so that's what I do. Make sure that they're seen by all the right people.
I'm the diabetic podiatrist, and I evaluate the high risk foot, and from my podiatry outpatient clinic I bring through to this clinic the high risk foot with complications that need a team intervention in a timely time to help prevent amputation. So I'll be looking at a foot that has an acute problem and presenting it to this clinic.
My role is to look after patients' blood supply as well as coordinating patients' journey from accepting referrals and seeing patients in clinic, as well as admitting them to hospital if required.
Yeah, I'm the wound care specialist, so my role is really to make sure that the wounds are progressing, debriding the wounds, finding the right approach to wound care, working together with the team, and also leading the team in terms of the right approach. I do a lot of debridement, sharp debridement, especially here in the diabetic foot clinic, which is important to get the wound into the right direction so it can heal.
Patients that are referred to us are from the GPs, and they're complex patients who have diabetes, who have lower foot or lower leg issues that need a multidisciplinary approach in order to either heal their wounds or find out what the underlying complications are for them.
I'm an orthotist, and my role here is making TCCs, or total contact casts. I'm putting total contact casts on people's legs. The idea is to reduce pressure, so people presenting with ulcers, we want to take the pressure away from the ulcer side and allow for healing. We also use it for edema control and stabilising the foot to prevent further deformity. Other things which I'm here for also is to look at their footwear. So if they cannot buy footwear to fit them up the street because of the shape of the foot or the size of the foot, or because of their mechanical problems with their foot, then we organise footwear to be made for them. We organise insoles to go inside those shoes to again redistribute the pressure and unload peak pressure areas on the bottom of the feet. And that's the main things I'm here for, I guess. Yeah.
And sometimes if they're people we know and they're regular patients, then we are able to bring them in and out, and I can often just be the one that sees them if they've already been through the consultation process, or it might be that they're ready for their new shoes, so that's when we get them to be seen by Brent, or if they're needing their specialist podiatry, because it's often 6 weeks between, well, then we'll bring them in. It all depends on what we see in that first, but all new patients are seen by everybody.
What happened in the past was I'd get referrals from the specialist, whether it be the orthopaedic specialist, the surgical, or through the wound care specialist, and the patient would be sent to me with a script on a piece of paper explaining the condition and the problem. And we never got together to treat the patient as one person. And now we've got all these specialists here in one group.
Yeah, it's very beneficial. So it's basically a one-stop shop for people with diabetic foot ulcers. So they're coming together and we can work all together to achieve a goal, which is reducing the amputation rates here in New Zealand. And overseas has shown, and also have shown here in Dunedin Hospital already, that we can actually reduce the admission rate to wards and keep people out of the hospital as long as possible.
We work closely together with the community district nurses as well as with the GPs. GPs can make a direct referral to the diabetic foot clinic using a traffic light referral system, which helps identify high-risk patients.
The patients find this very successful in that they're getting their treatment early. They're not on long waiting lists, and having treatment and foot problems seen early prevents those going on to something that could end up in an amputation. So for them, it brings their treatment forward, and that's what we can do to prevent an amputation.
Well, it's really fantastic, this teamwork here. We're very proud of it. We are working together as about 8 people together. Everybody brings their speciality to it, their experience. You know, we're coming from different angles and finding the best approach to heal very complicated wounds.